So my project is on the scope of nursing practice. For those of you who are nurses, you probably already know what the scope of nursing practice entails. The definition is the roles, functions, responsibilities, and activities which a registered nurse is educated, competent, and has the authority to perform. This slide basically highlights the who, what, when, where, and why of scope of nursing practice. Obviously, it applies to registered nurses. Scope of nursing practice is protecting, promoting, optimizing health, preventing illness, facilitating healing, alleviating suffering, and most of all, advocacy. Scope of nursing practice is applicable whenever and wherever there's a patient who needs care. It involves nursing knowledge, compassion, and expertise. We have scope of practice so that patients have positive outcomes and those who are practicing in healthcare are doing the things that they're supposed to be doing. Here are 3 SMART objectives that you guys will be able to learn/identify by the time this presentation is over. As you guys already know, healthcare is rapidly changing. As healthcare changes, nursing evolves along with it. Due to the changes in demands from healthcare, this can lead to changes in scope of practice. This can broaden our scope of practice, allowing us to do more, to be trained on more aspects. But the main goal of the scope of nursing practice is to ensure that nurses are doing what they should be doing according to their education and their skill level. While we're keeping this in mind, different institutions, different states, they all have their own policies and mandates on what nurses can do versus what they can't do. For those of you who are nurses, you probably remember ADPI from nursing school. This is one of those things that kind of sticks with you. This basically goes over the nursing scope of practice. So this allows us to assess, diagnose, plan, implement, evaluate. Obviously, as a nurse, we do not have the ability to diagnose a condition, although we can identify a problem through nursing diagnosis. This is kind of the fine line that separates us as, you know, PCCAs, CNAs, MAs, LPNs, RNs, MDs. Obviously, we can all do different kinds of things. We just have to make sure we're staying in our scope for 1, legality, and 2, for patient safety. Every member of the healthcare team is vital. We all just do some different jobs. Scope of nursing practice ensures that nurses are doing what they're supposed to be doing and that everything's kind of flowing properly. Obviously, as a nurse, you're not going to admit patients, diagnose, prescribe medications. As a nurse, you're going to administer those medications, assess patients, delegate as needed, and carry out doctor's orders. PTCAs are going to help, assist in the registered nurse, doing vital signs, daily cares of patients. We all have our own niche that we take care of at work, and it helps things flow and also keeps patients safe. Nursing scope really exists to benefit society. It keeps patients, nurses, and the community safe. It also allows for patients to get the best care possible because the areas of practice are separate and each individual knows what they should and shouldn't be doing. Each nurse has their own education level, their own set of skills, a patient population that they're really comfortable taking care of. It's important to know your boundaries as well as your full extent of practice so you can give what you have to offer. Nursing scope of practice is really just there to maintain patient safety, to make sure we're not going over any boundaries, and to also make sure that we're doing what we are capable of doing. Although nursing scope does depend state to state, institution to institution, it's really just important to know what you are able to do versus what you aren't able to do in order to keep patients safe as well as practice what you are able to do.